My name is Ellen Sheris Umo, and I'm going to be your moderator today. And just before we start, I really just want to welcome you all on behalf of the EST UK Academy to this great webinar, How to Make Sense of Your Research Studies. And just to mention that this session is going to be recorded. And if you have any objection to that, you can kindly decide not to turn on your cameras. Otherwise, if you need to ask any questions or make any contributions, we probably will have to ask you to turn on your camera just so that it makes the session more lively and interactive. And together with me today is Dr. Kalu, who is one of our speakers. He's well known to us. I don't need to introduce him. And the second person is Dr. Musa Mohammed, who is also a grounded family member to this great academy. So you're both welcome to today's session.
Thank you very much.
Yes. So as we all know, some of us have gone through the flyers anyway, and some of the materials that have been sent out for us to go through. We will be discussing about how to make sense of our research studies. Research is not one of the very exciting things for people who really don't have interest in it, and the interest in research starts, or it's built up gradually. So it's a great privilege to have someone who is happy to put us through and who is willing to, will I say, hold our hands and journey with us through our research journey. So without wasting much time, we are going to introduce Dr. Kalu, who will be taking us on our first talk on how to make sense of research studies using the cohort studies as an example. Dr. Kalu, over to you.
Thank you very much. I'm pleased to be here. Can you hear me?
Yes.
Yes.
Okay. Yeah, you're welcome, everyone. It's always a privilege to be here to talk to us and to interact with us. Today is another day that the Lord has made for us to be together and discuss about research. So I welcome everyone, and thank you for finding us worthy to listen to us, so we don't take your time for granted. In a couple of minutes, I'm going to talk about making sense of research studies, and a subtopic under that will be understanding cohort studies. And we're going to be discussing these things in lay terminology. So if you're already advanced in research, apologies if what we are saying may be too elementary for you, but we'll try as much as possible to carry everyone along so that when anyone who is very new or newish to research, they will still enjoy what we're going to be talking about. Thank you, Dr. Elaine, for that warm introduction. And thank you in advance to Dr. Musa, who is going to take us through the practical section. So we hope to take us through this section for the next 1 hour plus. Relax and let's enjoy our search together. Okay, so this is the outline I'm going to use to have our section, the first part, and that would go through what are research studies and why are research studies done. We'll look at the types of research methods and the key features of research studies. We'll also want to know what are cohort studies and why are cohort studies important. And again, we'll conclude. After the conclusion, I'll pass you back to Dr. Elaine to do a bit of a reflection, and Dr. Musa will take over from there, after which, if you've got any question to ask, then the section will be, the microphones will be open up for you to ask your questions. So just pen your questions down. You can as well use the chat box to document your questions in case you think you will forget them. All right. So this is a very important question. What is a research study? We keep hearing about research. This is a researcher, this is a scientist, he does experiment, he does that with in the lab, he's trying one or two things. So, but what exactly is research in lay terms? So it's a careful investigation or examination of a topic or question to discover new knowledge or answers. So you are carefully examining things, or what you may call investigation of a topic or a question to discover new knowledge or answers. For instance, your question might be, is there a cure for a particular disease, say HIV and AIDS? And that question is troubling your mind as a scientist. You might now want to do a careful investigation. That is what they call research, to find out the solution to that and add to the knowledge of evidence. Why are research studies done? Why do we even bother to do that? Is it really important to do research? Yes, it is important to do research. And one of the reasons would be to answer important questions about health, behavior, or other topics. So if you're a business person, you've been doing business in a particular way and you think it's not going on well, you might want to ask yourself, why am I not making the adequate profit I think I should be making? So it will prompt you to go and do research, to ask the important questions. So the next thing is understand causes and effects of certain things. You might be aware of cause and effect response. For instance, is already a body of knowledge that when you smoke a lot, smokers would sometimes go on, or most times will go on to develop lung cancer and other health conditions. You might want to do a research to find out, is it really true, by doing some form of exposure, people who are already have been exposed to smoking, and following them over time to find out whether they develop maybe lung cancer or other conditions that smokers are liable to. And it might also help you to find new and better ways to prevent, diagnose, and treat diseases or conditions. Even as a student, it might also be necessary for you. You've been writing an exam, or you've been doing one or two things, and you think those things have not been working well, and you're asking yourself, what are the new ways I can do that? So research is important. I guess what I'm trying to say here is that you can apply the research skills you get into every aspect of your life. And it also helps inform decisions and policies that affect people's lives. Most of the things we see, policies here and there, some of them are based on evidence from research. They will say a randomized control trial has been done on this. That is why we are implementing this new policy. Or a systematic review has been done, collecting available evidence on a particular area. And people are more likely to trust that because it's a body of evidence through research. So what are the types of research methodologies or methods in research? Research is not just you walking through the park. So it's not a walk in the park. So there are things that there are methods to that. So it could be a qualitative study, or it could be a quantitative. And in other cases, it can be a mixed method. So mixed method will be combining qualitative and quantitative studies. For qualitative studies, it's more about things like interviews and focus group discussion. For instance, you want to know how people are feeling about the recent economic situation, maybe in your country. and you decide to gather people from different states, one person from each state, for instance, and you start interviewing them. How do you feel about the economic situation? So you're conducting an interview or a focus group discussion where you bring group of persons and you're trying to find out find out things from them. So those are the things you call qualitative studies. But in quantitative studies, you are doing you are doing things a little bit different. So it could be observational. You're just observing people, of which cohort studies that we're going to be talking about is part of them. So you're maybe interested in checking if the example I gave before, smoking and not smoking, whether it leads to um, lung cancer or other health conditions. So you just observe people who have been smoking over time, say 10 years, and you observe other people who have not been smoking over that same period and check at the end of that 10 years, did the people who smoke have more lung cancers than people who did not smoke. So you are just observing. It could also be an experiment. So what we call trials, you actually try to intervene. For instance, for pharmacists or pharmacological companies who pharmaceutical companies who develop medicines for us to use, they might want to try a particular medicine, maybe to control high blood pressure, and they will compare it with an existing medicine or no medicine at all. So you can have two groups of people. The first group will be receiving the medicine they are trialing, and the other group will receive nothing over a period of say 6 months, and they will now come back and check, did the new medicine they try to introduce cause any reduction in blood pressure? Did it improve the health of the people? So that's the kind of experimental research. So it could also be clinical trials. I've talked about it. So clinical trials can be under experimental research. So what are the key features of research studies? I mentioned before that research is not just whenever you ask question, you also get the answer immediately. So there are features, there are things that you must do or are expected of you if you're going to be carrying out a research. And one of those is clear question or goal. So what's your research question? What are you trying to answer? What new thing are you trying to discover? What new improvement are you trying to make? And in those questions, there are different frameworks you can use. So that is beyond our discussion today, but it's just to whet our appetites and make everybody comfortable with what we're talking about. So your research has to be well planned and well designed, and it has to have a very good method that you're going to apply. So doing a research takes some time because you need to plan it. You need to plan the people who are going to use, the logistics, the methods you're going to use, your analysis of your research. All those things would require time and planning. And usually there will be data collection and analysis of your results and conclusions. So when you want to do observations, you're trying to measure some things while you're observing things. You might be measuring the health condition of the people. You might be measuring their blood pressure, their height and weight, the sort of food they're eating, all those sort of things. So there are data you're collecting, and at the end, you will analyze those results and give a conclusion based on your analysis. So in your research team, you might be having analysts, you might be having recruiters, you might be having people who would be doing one thing or the other. In fact, your research will also go to ethical committee for clearance. Your research must be approved before you go ahead to do that. So it takes a little while. And also, when you have finished conducting your research and your findings, it's important and well encouraged that you share your findings with others. so that other people will improve in their knowledge as well. So let's now go to cohort study, which is an example of what we're going to demonstrate in the second part of this section. So what is a cohort study? It's a type of research, actually an observational research, where a group of people are followed over time to see how things affect their health. So, for example, if you're trying to study a group of people who exercise regularly to see if they are less likely to get heart disease, um, some of us or most of us may know the importance of exercise. It's possible that your doctor or your healthcare um, professional may have advised you that it's good to do exercise, but that's more like an expert advice or expert opinion. So if you want to go further to discuss or find out evidence on that, you might decide to watch a group of persons and see their attitude or their physical activity, exposure to physical activity over time. And you now measure maybe after 5 years, those who were exercising and those who weren't exercising, how have they fared with respect to the outcome of interest? The outcome of interest in this example is heart disease. Did those who exercise more have less risk of having heart disease than those who did not? So that's a type of research study, and it's called cohort study. So why are we bothered about cohort studies? Because it helps us to understand how different factors like diet or exercise affect our health over time. So many times you're not able to do experimental studies on human beings because it might be unethical or it might be health damaging to do that kind of a thing. Take for instance, you cannot tell people, this group, you're going to be smoking, and this group, you're not going to be smoking. Obviously, you know that smoking is health damaging, so you cannot use trials for that kind of study. However, you can monitor people over time, observe them, we respect their habits. So an example is a cohort study might help us to understand if eating a certain type of food can increase or decrease our risk of getting a certain disease. In the critical appraisal that Dr. Musa would handle, we'll see the effect of diet on repeated miscarriage. So he's going to talk about that, but that's an example. So how do we do cohort studies? So let's see these researchers who are sitting here and they are trying to do cohort studies. What do they really need to do? They will need to recruit a group of people and collect information about them over time. They might ask questions, take measurements, or collect data from medical records. So there are different ways you can recruit people, which is a bit beyond our discussion today. But in cohort studies, you're going to have a group of persons. Maybe a good example might be alumni of a certain university. So if you have gone through the university, your classmates, you might want to follow them up. Cohort studies must not be just health related. You might find out that during our final year days, usually they will ask us, what do you want to become or where do you want to specialize? So you might decide this might be a research for somebody here if you're interested in that kind of research. You might go back and ask in like as the people are about to graduate, some will say they want to be neurosurgeons. They will say they want to be business people. Some will say they will want to be that. So you can follow those people up. They were exposed to the same thing over time, and at the end of 5 years, you might want to take a record and see who actually became what they said they were going to become. So it's a sort of observation over time. And a researcher might ask participants to fill out a survey. Survey is more like a questionnaire that people fill. Those papers that researchers or students or even scientists will give to you. can you help us fill this form? So those are surveys. So they might ask every year, send you that form to fill. So if we go back to the example we gave, the sort of diet people eat, it might be every year they would ask you that question and measure some things. At the end of 10 years, they will now be able to make a conclusion or a decision based on what they have found to say. It's possible that eating good diet is will make you less likely to have heart conditions. So, so what can cohort studies tell us? It can help us understand how different factors affect our health and how we can reduce our risk of getting certain diseases. So a cohort study might show that people who exercise regularly are less likely to get heart disease. And what are the limitations of cohort studies? Cohort studies is not perfect. So this is a diagram they call the hierarchy of evidence. So all this, what it actually means is when you want to make a decision based on evidence, there are levels to that. And the higher the evidence, the more certain or the more confident you are, or the more you trust that evidence. So we can see that expert opinion is towards the base. So the advice you get from your professionals, and case reports are more like a number of um, events happening at the same time, but you haven't done any study about them. You're just an astute professional identifying things happening at the same time, so you can do a case report on them. So we have seen cohort study on top of it. Between case report and cohort studies, usually you will also find case control studies, but we see where cohort study is. So it's not at the top. Randomized control trial is on top of it, and even systematic reviews of randomized control trials will be at the top. Mind you, this is quantitative. So qualitative researchers will tell you that this might not truly hold for all studies, because in certain studies, you will need to have subjective experience of people or look at how people behave in a certain context. So in that situation, you are not able to answer your question using quantitative method. I don't know whether I've become more technical at this point. So cohort studies are not perfect, like I said, and there are some things to consider when interpreting the results. Reason is because a cohort study might not be able to prove cause and effect. Cohort study, you cannot, based on cohort study, say that this is really the cause of this. Unlike in randomized control trial, where you have two groups and you're introducing an intervention, you're directly introducing something. I gave us the example of pharmaceuticals trying to bring in new medicine or new drug to reduce high blood pressure. So they might have two groups that they have randomized. So they have randomly selected two groups. The first group, they gave placebo or they give nothing to them if there is no medicine for that condition. Obviously, in high blood pressure, there's medicine for that. So if you're looking for a medication that will supersede the one that is already available, you have to compare it with already existing medicine. So in that case, you give that one group, the existing medication, and the other group, you give them the one you're trying to introduce. So after a while, you try and check whether that medicine you have introduced, the new one, had more effect in reducing blood pressure. In that case, you would establish that it is the cause of that reduction in blood pressure. So, but in cohort studies, you are not able to establish that causal relationship or cause and effect relationship, because there might also be other things that are responsible for what you're observing. For instance, when we're talking about food and heart conditions, so if you have observed people who eat healthy food and people who don't eat healthy food over time, and at the end, eventually you saw that people who don't eat healthy food developed had higher risk of developing heart conditions. So it might also be that there are other things really that is responsible for that. Things like age. It might be that the people that are in the group that were not eating well, they were in older age group. It could also mean that they were not exercising, and a number of other things. Might also be that they are genetic conditions, or they are genetically predisposed to having heart conditions. So some of those things are what we call confounders that might interfere with your results. So those are some of the limitations, and it might be affected by things like people dropping out of the study. That's a common problem of cohort studies. That's what they call loss to follow up. So sometimes if you're going to observe people, just say if you're going to observe people for 10 years, some persons might become tired along the line. Some persons might die along the line. Some persons might just disappear. They may change address and stuff like that. So it's possible, it's a problem in cohort study. So, but remember I mentioned that cohort study also has its strengths, like we did talk about them. And also there are situations where cohort study can only be um, the the study of choice, because you cannot subject people to certain harmful experiments or interventions. So how do we understand, how can we make sense of cohort study results? If someone brings a paper and it is a study that is called, is a cohort study research, how can you make sense of it? How would you know that they have not bamboozled you or scammed you in what they did? So you have to check if the study was well designed and conducted. You have to look for explanations of the results. Have they presented their results well? You have to consider the limitations of the study. There's no study that has no limitation, even systematic reviews. If you have looked at that evidence, hierarchy of evidence, even systematic review that's at the apex also has its limitation. Has the limitation been adequately considered? And also look for other studies that confirm or contradict the results. So is the results the only result saying a different thing, or is it in line with other results? So you need to also have done your literature review and see what other studies are saying. The other thing is, you also, even before you apply that results, you need to check whether it's really applicable in your environment or in your particular situation. It might be a cohort study that is done in a different country or even a different continent. And if you decide to implement it in your own country that has different demographics, it might not really work. So in conclusion, cohort studies are important too for understanding how different factors affect our health over time. And by understanding cohort studies, we can make informed decisions about our health and well-being. Thank you for listening. And I will now pass you back to Elaine for her reflections. Thank you very much.
Thank you. Thank you so much, Dr. Kalu. Thank you for this lovely run through and detailed explanation of the study designs, especially the cohort studies that you've gone through. So you have said a lot about this kind of study, the cohort study, and how to go about doing it, and even checkmating your answer. So just a little bit of recap of what Dr. Kalu had gone through with us, just for us to kind of reflect on what we've been taught. So he started off by talking about what is research, and then why do we do research? simply to answer questions, that there's something bothering us in our minds, or there's something going on that we need to answer. Especially in this climb where we find ourselves, they will always tell you that you do things with evidence. So things are evidence-based. You don't come and start talking without your evidence. When you're done, they will ask you for evidence. I'm sure that's where audits here is in the UK is very common, that before you do anything, you need to say where your evidence are. And so you're trying to answer a particular question, or you're trying to check, is there a relationship between this result and what causes it? So like cause and effect. Oh, this disease, and what is the cause of this disease? This person is exposed to this thing. Could this be the reason why the person developed this disease? In the case of smokers, in the case of those people who had all those other lung disease from asbestosis, there was a lot of those kind of studies that had to be conducted to be able to find the cause and the effect. And then he went ahead to tell us about the different types of research, which could be qualitative or quantitative. And qualitative research are just the normal questions, or the interviews, or the focus group discussions we normally will go through and answer questions. And, we can bring up a paper from that, from just those kind of interaction. Or a quantitative research, which is a little bit more detailed. And in that one, in the quantitative research, Dr. Kalu took us through the observational studies, which the cohort study happened to, or the cohort study, or the cohort study design happened to be one of them. And in discussing that, he told us about what a cohort study is. A cohort study means it's not an experiment. So what it basically means is that you have a group of people or a group of subjects which you observe over time. So they all will have different features or different factors that are acting on them, and you want to see what the effect of those factors would be at the end of a particular number of years or months or days or weeks. It just depends on the length at which the outcome of interest, the number of days or the years or the length that it will take the outcome of interest to manifest itself. So basically, you observe people over time, or you observe individuals. It can also be animals. We do that in lab rats as well, so that you don't think that it's all about medicine. It's not all about medicine. And I like when he said, even in our businesses. So sometimes you can do this thing even in your business. You're not going to do any intervention. You're just going to watch and see what happens over time, up until when the outcome of interest, develops, or at the end of the particular number of the time, at the end of the time frame, you start checking to see which of these your subjects have developed the outcome of interest. And then you can now start to decide, or you can start trying to make inference and see if there was a relationship between the factors that they were exposed to and the fact that they've developed a particular outcome, whether it's infection, whether it's even pregnancy, and all, or twin pregnancies and all. So that's basically what's, in other words, what Dr. Kalu has taken us through. And he also mentioned something about features of research, that if you're going to conduct a research, whether an observational or an experimental or a clinical trial, you must have some it is an investment in your time and resources, and you have to plan. So you have to have a goal, and you have to plan as well of how you want to really go about this research. You also want to know that at the end of this, after, how will you collect your data? How will you analyze your data? And also, how will your discussion and presentation of your result findings be, you know, at the end of your research, because you need to make an impact. And what's, you know, what is your research at the end of it? What is it answering? You know, has it answered what you wanted it to answer or not? If it hasn't, you may go ahead and find out why this research didn't answer your research questions, or why didn't you meet your goal in this research. It is also important to know that there are factors that affect, or there are limitations to a cohort study. You know, you cannot solely rely on it, especially for one of the reasons he mentioned about the co-founders, that you may be doing your experiments or your research, but there are other factors that are also affecting the results. So at the end of everything, you are trying to, say, for instance, give everyone the same food to eat, but you have elderly people who don't have teeth, so they cannot eat the meat that you're putting inside, who their intestinal tract or their intestines have already grown old. It cannot absorb as much as it should. You know, you cannot, you have to bear all those things in mind when you are interpreting your results, so that you don't, you know, because they will constitute some form of bias for us. Other things to think about is also that there are people that are not, that, you know, they will be lost to follow up. I think that's what they call attrition rate. You know, they're going to drop out. It's too long for them, or they've died, or they've changed location, or, you know, so you have to factor in all these things. And you have to also have it at the back of your mind that a cohort study, as Dr. Kalu has said, cannot link a cause and effect kind of study research, or kind of, you know, it cannot answer a cause and effect question. So it is one of its limitation. If you're trying to look out for what causes a particular disease, or why is this happening, it is advisable not to use a cohort study, because there are a lot of other factors that are going to affect it, and it may end up giving you a very wrong picture. And, you know, the last thing he spoke about is to how to make sense of a cohort study result. So one, you have to check if the study was designed well. You have to check if, you know, the explanation of the result was done correctly. You have to check even the representation of the result, was it done correctly, you know, and every other thing that has to do with research. Generally, there's a checklist that we are going to discuss about in the next session, and that you will be able to take care of some of these questions, so that at the end of everything, when we have research and we are presenting it, we are sure that we are going to tick all the boxes, and our publications will be, or our research will be accepted for publications. So permit me now to invite Dr. Musa. Dr. Kalu, thank you so much. Sorry. Thank you so much for taking your time to explain all this for us. And I'll be calling on Dr. Musa Mohammed, who will be taking us through the critical appraisal skill program checklist for a cohort study. And that will take the next 20 to 25 minutes. Thank you very much. Dr. Musa, over to you.
Thank you, Dr. Ellen, and hello, everyone. It's good to be with all of us here. Please tell me if you can see my screen. I think I don't have permission to share. Can someone grant me admission, please? Ellen, would that be you?
No, I think it will be Dr. Kalu.
Okay.
Or the admin here.
Okay. Is anyone able to see my screen, please?
Yes.
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 All right. So thank you everyone for being with us, and thank you, Dr. Kalu, for the opportunity. So I think Dr. Kalu has done very well to take us through a lot about research and how we would look at research. So we'll be going through a cohort study now, which is one of those studies that Dr. Kalu has discussed. Particularly, this study is titled The Association Between Periconceptual Maternal Dietary Patterns and Miscarriage Risks in Women with Recurrent Miscarriages. And this is a multi-center cohort study. So this study is simply trying to look at the relationship between what women eat, women who are pregnant, around the time of conception, and the impact it has in pregnancy in terms of loss of pregnancy. I think in this study, they defined the miscarriage as loss of pregnancy before 24 weeks of pregnancy. And 3 centers were involved within the UK, centers in London, Birmingham, and Coventry. So for this study, I think we can just dive into the analysis. We're using the CASPER checklist. And the checklist basically provides you with questions, and then you're able to answer it as a way to critically appraise any paper. So for this study, the first question we're having is, did the study address a clearly focused issue? So I think for this, it's a yes, because it told us that it's trying to, the aim of the study is to see if there is any association between periconceptual maternal dietary patterns and miscarriage risks. Also, in reaching this answer, where I said yes, we looked at these considerations here, which are the population, and the population is for women who have had recurrent miscarriages already, 2 or more miscarriages. I'm hoping that many of us might have gone through the paper, so it's a bit easier to follow. And for the next, the risk factors that were studied. So the risk factors were mostly, the food that were consumed. Were they consumed in low amount or high amount? And that was how they tried to do their analysis and get an outcome. And then next is whether the study tried to detect a benefit or harmful effect. And I think this study did so, because it did say that it aimed to detect whether there is risk factors from eating those food items or not. And I think at the end of the study, it was able to do that, and it gave us outcomes. Okay, so going on, sorry, is my screen still visible? I just tried to make it a bit bigger.
Yes, it is.
Okay. To the next question, was the cohort study recruited in an acceptable way? So for this particular study, I thought that it's also a yes, because we had a defined population. We knew who we were testing. It wasn't just anyone, it was particularly women who have had at least 2 miscarriages. And these women were recruited from 3 university teaching hospitals. We also had clear inclusion criteria. For women with 2 or more pregnancy losses, that was our major inclusion criteria. However, if you look at this consideration part where it says look for selection bias, which might compromise the generalizability of the findings of our study. I mean, for me, the study made efforts to minimize selection bias, But I was also wondering, because it's a cohort study, it's very difficult to eliminate bias completely. So because of that, I wasn't sure if it's a complete yes for that particular. But generally, I think the answer to this question is a yes. I'll be waiting to hear feedbacks from colleagues. Okay, and then to the next one, question 3, where it says, was the exposure accurately measured to minimize bias? Well, I thought it was a yes for this one too. So the study did mention that it used a 10-point item food frequency questionnaire to get reported outcomes from those women who were included in the study, and I think we would classify that as subjective rather than objective. But because they were followed up closely, which I think we would come to another question about that later. So I think we wouldn't say that because this is subjective, maybe it's a limitation. But anyway, I think we will speak more about that in a subsequent question. And if you look at the next consideration, which says, do the measures truly reflect what you want them to? I think yes, because we got our outcome from this particular study. And to the final consideration, were all the subjects classified into exposure groups using the same procedure? Yes, they were, and they were all exposed to the same questionnaire. To question 4 now. Was the outcome accurately measured to minimize bias? For this one, I also thought it was also a yes, because the outcome, sorry, the self-reported data is subjective. However, they did well to also confirm any reported variable by any of the participants by also looking at the clinical records of these women who were involved in this study. So women would fill the questionnaire telling about how much they consumed some of these food items that were included in the questionnaire, and what was the outcome. Did they have miscarriage, or did they even become pregnant, and did they lose that pregnancy before 24 weeks, which is classified as miscarriage? And for the researchers, after taking those questionnaires, they always went back to also look at the clinical records to double check and make sure that whatever the women were reporting was also similar to what was found out in clinical consultations with them. All right, going to the next one, have the authors identify all important confounding factors? I think Dr. Kalu has told us about confounding factors and how they can affect cohort studies especially. So in this study, for me, I thought it was difficult to answer the question with a simple yes or no, because they did try to account for a number of confounding factors, such as age at conception, BMI, the ethnicity, smoking, and alcohol intake. Also, they did account for number of previous live births, number of previous miscarriages. However, as we know, there might be some unknown confounding factors which were not accounted for. And a few which I could think of was chronic illnesses. They can also have impact on the likelihood of having another miscarriage for those women who were tested in this study. And then also psychological stressors. And moving on to the next question, where it says, have they taken account of the confounding factors in the design and or the analysis for this study? I also thought this was yes, because they did well to account for confounding factors, both in the design and the analysis phase. So I think that was an easy yes. Okay, to question 6 now, where it says, was the follow-up of subjects complete enough? Well, particularly, I couldn't see any follow-up period for this study. They did, I think, mention something about index pregnancy, which is the first pregnancy after inclusion in the study. But there was no particular mention of any follow-up period. You know, what was the duration of that period? But also one thing that was that stood out for me was the high exclusion rate in this particular study. About 2/3 of the involved study participants were excluded. Sorry, people who were considered initially, about 2/3 of them were excluded in the study. And I think that's important to note, because that can limit the generalizability of the findings of this particular study. Going on to the next question, was the follow-up of subjects long enough? Again, because there was no defined follow-up period, it's difficult to answer this question with certainty. Okay, to the results now. What are the results of this study? So I'll just show us. The study actually found that high consumption of fruits and nuts was associated with lower risks of miscarriage, and high red meat consumption was associated with increased risks of miscarriage. For some other foods that were tested, such as vegetables, they couldn't really find any significant associations. I think we can see the relative risks, and if we go to the next one, we can also see confidence interval and p-values given. So I know that we're trying to keep this as digestible to everyone as possible, but I would just tell us that these values mean that the findings of this study are significant. We have found a significant association based on these reported values. So I think, and that answers question 8 for us. How precise are the results? We are confident that these results are robust. Do you believe the results? Well, I find this question very direct. But I think, in my own opinion, I believe the results, because the researchers have done well to use rigorous methods. I think they use several methods of analysis, such as Poisson regression analysis. They also accounted for confounding factors, which we say have effects on our outcome if they are not well accounted for. So based on these, I think, and some other reasons, I think I would say that I believe this result. Can the results be applied to the local population? Well, this study focused on women who have had recurrent miscarriages, and then it found some associations with eating some foods. Nuts, for example, had a good effect by decreasing the rates of miscarriage. But would you then say that if women who do not have a history of recurrent miscarriage eat nuts, they would also have a lower chance of having miscarriage? Based on the findings of this study, it's difficult to say that, because you only studied a group of women who have had previous miscarriages. So for that reason, I think the answer to this question is a no. Then the next question is, do the results of this study fit with other available evidence? I think during the discussion part of this study, they did mention mixed results. For example, I think there was a systematic review that did mention there was also association between higher consumption of fresh fruit and lower risks of miscarriage. And that's similar to what this study found. However, there was also another study which found contradicting results for vegetables, for example. Vegetables, in this study, there was no significant relationship, but for the other study, I can't remember the authors or the name of the study particularly, but in that study, they did find that eating vegetables was associated with lower risks of miscarriage, so which in a way contradicts the finding of this study. So I would say that when you compare the results of this study with previously available evidence, you get both a yes and a no. And then finally, what are the implications of this study? So for this study, I think as many of us would already know, we have some strong findings. However, would it be enough to change practice? Many of us would know that one study would not be enough to change practice, especially a cohort study. We have seen the hierarchy of evidence as illustrated by Dr. Kalu, and we know that cohort studies are not even at the top, even though prospective studies, for example, are very good, also rank high in the hierarchy. However, one study alone is not enough to change practice. And also, as Dr. Kalu and Dr. Ellen have said, it's difficult for a cohort study to establish causality. And I think that brings us to the end of appraising this paper. This is the summary where you look at the positives and the negatives. And I think we have seen a few positives, such as accounting for confounders, the design of the study itself. However, we have also seen a few negatives, such as bias, which are not known. And these I think when you combine both of these, then you are able to make a comment about any study. I think I'll be stopping here, and I'll hand back to Dr. Ellen.
Yeah, thank you so much, Dr. Muhammad, for the beautiful presentation. Yes, even myself today, I've learned a new thing about the checklist for critical appraisal. I've never known there was anything like that. So it's really timely for it to come together, you know, during this session. So just a way of reflecting on what Dr. Musa have run through with us, discussing about critically appraising our work, you know, our research work following a cohort study. I'm not sure if other kind of studies too will have their own experimental, like a critical appraisal checklist, but I would think so if cohort study does. And not generally, from all what he has said, it's practically impossible for me to go through everything, to have everything he has said, like going through the checklist in my head. But I like just a way of summarizing everything. You know, you were just trying to answer questions to validate your work. You know, that this thing I have done, did I get a result? And is the result valid? So the checklist will help you to answer questions from the goals you set, to the planning, you know, to the collection of data. In short, from planning, even from to recruiting your study population. You know, if you heard very well, it was really it's hammered a lot about bias, because biases, there are a lot of biases, and they can affect your results. They can, you know, they can give us a very wrong conclusion of what a, you know, the of an experiment or of a research. So it's one thing that is really big. You must be able to sort out all the biases. Anything that can affect your result, you have to be able to deal with it appropriately. And it talks very clearly about it. So choosing your design, your goals and objectives, the way you collected your data, the way you factor in any bias that can affect your results. Did you really kind of did you really kind of follow your patients or follow your population up, and for how long? Because you have to say it, because it is a studies. So you, everything must be 100% equal for everyone. So if this group is going to get this treatment, then all of them should be able to get it and exposed over the same period of time. Otherwise, your research results will not be, or your conclusion will not be valid. And then generally talking about, did you even get the outcome? The results you got, was it what you were expecting? You know, because you all have to be able to answer, you have to be able to answer the whole of these questions, so that at the end of everything, you know that your research have passed at least the tests to make it a valid one. And from this critical appraisal, it said, when you're, because you can also appraise other people's work, just as Dr. Mohammed just did now, appraising the work relating diets to the miscarriage among women who have had recurrent miscarriage. You must be able to, there are people who appraise other people's work. So this checklist can also be used against your own work. And the truth of it is that from the inception, they've told you, if you don't see it, you don't respond to it. That's why there is a yes, there is a no, and there is a cannot say, because it also allows you, so it's either a yes or a no, and then you cannot say if it is not there or if it is not clear to you, but you cannot assign it a no just because it's not clear to you. So I think there is some fairness in using a checklist to appraise your work. There are a lot to say, and just to recap on this conclusion, on this critically appraising our work, it just tries to validate, you know, or to make sense of the cohort study that we have done, that our results and our procedures should be able to answer the research question. And be that as it may, it cannot tell you, a cohort study cannot tell you if truly the disease or the outcome of your study is because of the factors that you have noted, because it doesn't relate, or it doesn't link causality. So at this point, I would open the floor for questions. I will expect us to ask a lot of questions. Research is one very important topic that if you get it right, you get it right. If you're not able to get it right, it becomes a problem, because you will always look for someone to help you out. So I would really encourage us to ask as much questions as we can. So if you have any question, you can kindly raise up your hands, and I will call on you and direct it to the appropriate person as well. And if you don't mind, you can turn on your camera when you're asking a question. If you don't mind, if you mind, we're happy for you to speak off camera as well. Does anyone have a question? We are a house full. We are almost 20 something people, or almost 20 people here. Okay, I can see Andy. That's the much I can see on your name. Do you mind, Andy Kifasi, do you mind unmuting yourself and asking your question as well?
Okay, good evening, everyone. Thank you so much for putting this uh, research paper appraisal session. It's quite helpful. I'm just a bit curious. From Dr. Musa's presentation, he said he believes the studies and he listed out reasons why he believed the results of the study. However, he has also said that we cannot use, it's not sufficient evidence to change practice. So I'm curious, what then is the use of the point of believing a study if one cannot use it to make a decision to change practice? And then, in addition to that question, what should follow? If believing it is not enough, what are these things that needs to be done? Is it going to be a systematic review? Is it going to be an experimental study, or what should follow? Just ask them, please.
Okay, so do you want us to answer the question, or I think we can answer one after the, as in we can answer. Dr. Musa, are you happy to answer, to respond to this question? Just in 1 minute or two.
Yes. Thank you, Andy, for that question. So, yes, one study may not be enough to change practice. However, it forms the basis for other studies. And we have said that these kind of studies, cohort studies, are not good at establishing causality. So a randomized control trial may be considered to establish causality. And if you have multiple studies, there's no harm in trying maybe a systematic review, for example. But yes, one study may not be enough to change practice. I think that's a general principle. I hope that answers your question.
All right.
Yes.
Okay.
Thank you.
So thank you very much, Dr. Musa. Any other person that wants to ask any burning question, is keen to learn, you know? Andy, is your hand still up, or is it the old one? Okay, thank you. Any other person that is interested in asking a question? Okay. I can't see any hands up. So is it okay to call on Dr. Kalu?
Yeah, thank you very much, Eden, for that excellent moderation. Thank you, Dr. Musa. And thank you for your reflections as well to buttress some of the things, the key points that we talked about during the presentation. And I also want to thank everybody that made it to this point. I think it's high retention rates, the number of persons that started and stayed to the end. So it does show that we haven't wasted your time in any way. We'll be drawing a close to our meeting now, and we're expecting to have you around in our next webinar, second week of March. So I want to believe that we are adding to knowledge And let's make this a routine and a habit to come together to rub minds together. And we see to that in future or in the coming days, years, we can forge some research collaborations, some friendship, colleagues, and all that would help shape whatever we're doing. Thank you very much for coming, and I would say have a good evening and enjoy the rest of your week. Thank you very much.